Hello, it's Wes, SuperWes that is. With this video I wanted to talk about this trach. It's not much different from some of the other ones, but it's quite a bit larger. This is a 5.5 Bivona Pediatric trach. That is almost to the upper limits of the pediatric trachs. I'm going to go ahead and take the obturator out. If we look at the flange, we can tell what the trach is. Right here it says Bivona Pediatric, PED, which is pediatric. On this side, 5.5 millimeters inside ID, which is inside diameter. That's from inside wall to inside wall, just how much room they have to breathe. This white stripe down the side is the stripe to show up on the x-ray. Can't think of the name right now of it. The 8.0 millimeters OD is the outside diameter, and not the side outside the, not the part outside the neck, but the part inside their neck, because we don't want it to rub on their cricoid cartilage, and we don't want it so loose it's going to leak a bunch of air up through their mouth and nose. But then down below is the 46 mmL. That's now typically the length is from here, from the flange down, but this is a Flextend trach, so this is from the flange outward. That provides them some movement room, and it won't allow because it has this coil of wire around it, it won't allow them to kink off the trach. Keep in mind though, because it has a coil of wire in there, they cannot go into the MRI with this. If they do, they'll have to put in a Shiley trach for the MRI, and then when they come out, they'll put this one back in. This tube also has the new connector piece. It's the one piece connector piece. You don't have to take it apart to clean it and reuse it. It doesn't get stuck to ventilator tubing and other things you connect to it as much as the old style does. And it has this on it. This is the pilot tube and the pilot balloon. This tells us that it has a cuff. And because this is a Bivona tube and this is a clear balloon, that means it has a TTS cuff, which we fill with water. Sterile water. If you're in home care and you don't have any sterile water, use distilled water. And there should be a doctor's order for it. And to find out a little bit more about the TTS cuffs, please watch one of my other videos. Alrighty. Thank you so much. Bye-bye.